Thank you, Norbert. I have to say, as a mom, I feel very relieved to know that there's more pressure on my kids' teachers than on me, at least temporarily, perhaps, at least in kindergarten. No, that was great. Thank you. We have 2 minutes left. How do you want to extend the time for questions? You want to do 10 minutes? Yeah, okay. So we'll do 10 minutes of questions, and then we will break. So first, starting with questions from each other on the panel. Any? We've had discussions before the panel, so perhaps then we've covered all of our questions. Okay. Second, going to the forum members. Go to Rebecca.
Well, that was a really whirlwind panel. Left me with a lot of thoughts, but I'll try to be succinct. So I have 3 thoughts. One is mainly in reaction to some of Ramanand's questions and comments. You said something like, families aren't spending to reduce malnutrition. And if it's defined, if malnutrition is defined by stunting, I wonder, do families know what to spend on to reduce malnutrition? And more fundamentally, do we know what they should spend on to reduce malnutrition? And just to remind us all that from the nutrition perspective, the best of nutrition interventions reduce stunting by about 1/3. The best of postnatal nutrition interventions reduce stunting by about 1/3. So if we're using stunting as a major benchmark, and economists clearly love it, they have taken it and run with it, which is good, but we should be clear that there's a lot about stunting that remains a mystery to us. And as far as we know, it's not just about nutrition. My second point is, given that, and given the side comments that keep emerging about obesity and how some of our interventions could increase the trajectory of obesity, or pathways to obesity, do we need to come up with some more integrated statistic for nutrition that represents the proportion of children who are non-stunted, non-obese? So create a positive statistic that takes away the stunted and obese, so that we're looking at positive statistics of healthy growth rather than one or the other negative statistic, and they mask each other. They're related to each other. They're related to each other in Africa. In Nigeria, the stunted children are more likely to be obese in many sectors of the population. My third comment sort of integrates across the early emphasis and then the school emphasis, which is, as we build toward a framework for action, it seems that we need to focus on different stages. The early, and I would even include prenatal, which has not been as much a focus of our conversations thus far, but remember, it's not all a postnatal story. A lot of things are set up prenatally. Sort of the prevention aspect, and then, sorry, I come from a biomedical discipline. What Norbert is sort of talking about is the treatment. So, but do we need to have a framework that lays out the prevention in the early years, and then what do we do now at kindergarten and beyond that treats the disparities and narrows those gaps?
Somebody else, Albert, please.
Okay, thank you very much for the wonderful presentation. I restrict to one comment and maybe a question, particularly to Paul's presentation. I think they're all very good presentation, and I'm very fascinated with your work on improvement of the mother and child intervention, the effect of stimulation, cognitive development, how they impact the children in terms of the job and wealth later on. A lot of study done in the developed country, low-income country. But I was thinking in high-income country, we also have the same problem now, because of the working mothers and deprived of the mother-child interaction, and sometimes they might have a carer, but they may need a domestic helper, not giving the same kind of stimulation as mother. And we're beginning to see some of the child adolescent problem of those people from that developed part of the world, especially I'm talking about in the eastern part of Asia, rapid developing in terms of economy, we are beginning to see some children-adolescent problem due to the mother and child interaction. I just wonder whether we should also not to underestimate the problem on the other side of the coin, and then also do some similar study to look into how, in a way, changing society, and how do we make up for the deprivation of the mother and child interaction in what we call advantage group, but also leading to disadvantaged children later on for one or the other reason.
Thanks. I'm Don Bundy from the World Bank, and I wanted to follow up really. I mean, Peter Singer mentioned the need to think about reaching potential and of not focusing on specific risk factors in a sort of agenda-specific way. And one of the questions that we've been addressing in the context of operational work is that we're being asked by countries, okay, we want to focus on the early years. What else should we be doing? Is that all that we should be doing? And how do we frame that question? If I deconstruct your presentation, Paul Gertler, you said that the early disadvantage has long-term consequences, which clearly showed, and that it was cost-effective to intervene early, and in this case with stimulation and with nutrition. You then said it was hard and expensive to compensate later in life, and you didn't actually present any evidence for that. But I think the point that not intervening early would be very difficult to address later in life is the point you were making, and I think so far everyone would agree with all of that. The question really comes to should we be doing nothing after 36 months? And if we should be doing something, what is it we should be doing? And so my question to you is, do we really have answers for that at this point in the discussion?
Okay, we'll take one more question from Joan.
I want to underscore what Rebecca just said about this life course, because I think the message to me about this panel is that it's the prenatal to 8 period, and that there are things that we can do along the continuum, and we have to keep reinforcing that and not playing one period against another. But Norbert, my question is, the attributes of the teachers that you think made a difference. I mean, I realized they had better class scores, but what was underneath that? What did you see in effective teachers?
Hi. Starting with the question from Rebecca. Do we know what reduces stunting? And of course, do the parents know what is going to reduce stunting? That's a really good question. There's obviously, that's the point I was trying to make with the fact that the direct programs are only going to go so far, and that's only a third. And then you have the other 2/3, which are, various other sorts of factors, including sanitation, including women's empowerment, lots of other things that come into play there. We do know that these Indian kids, when they're in the US or in South Africa, that they actually, they're at the same, there is no stunting. So it's not something that's biological as some folks have hypothesized. So the answer is, well, it's something else, which is broadly environmental and therefore falls into the realm of public policy. So I agree with you, but even for the things that are about reduction of stunting that are within the influence of parents, there doesn't seem to be as much of the diet diversity, for instance, which is within their control, that you might expect, given that they do have disposable income. And that's really the conundrum.
Just one comment for Joan and one somewhat tangentially related to what Don Bundy was saying. The class scores, there's 10 different dimensions, 3 different domains. They tend to be very highly correlated with each other, those 10 different dimensions. Now, we don't know, we could have a longer conversation about this, we don't know to what extent the correlation between these 10 different dimensions is because better teachers are doing a lot of these things sort of at the same time, or because it is also a problem with the way in which it is coded. Basically, you've got a coder who's looking at a piece of video that's 20 minutes long and is being asked to score a teacher on 10 different dimensions in that video on a 1 to 7 scale. Now, it turns out that the coding that in our Ecuador study, that we have all of the videos are double coded. So the intracoder reliability actually in our study, which again I find remarkable, is 0.93. So essentially they're giving the same scores. The issue is more along the lines, I think, the measurement error that comes up, which might confound some of this thing, is you see a teacher and you've got 20 minutes, yes, you're trying to follow these 10 different things that you're scoring her on, but I think largely you kind of get a sense of what the teacher is doing. Yes, at the end you give these 10 different scores on a 1 to 7 scale, but I'm guessing that some of the correlation that is within class different dimensions is real. You know, Joan is a better teacher than Norbert, but some of it is just that it's hard to keep track of 10 different things, so when I'm scoring Joan higher in one dimension, I'm also scoring her higher in other dimensions than I am Norbert. What is the implication of that? The implication of that, basically what it means is I have a lot of faith in the overall class score. Bridget Hambret, Bob Pianta, and others, when you aggregate all of that, they call it as a measure of quote-unquote responsive teaching. I have much less faith in looking at one versus another dimension because they are so highly correlated. And if you throw all 10 of them in together, you get essentially econometric gibberish because they're so highly correlated with each other. So it's not as if I can tell you, it's this one thing that they were doing, but I can tell you the teachers who were doing all of these things, that explains 34%. That's a huge amount. So that's actually the message on that. I wanted to make a comment on Don Bundy's point. I mean, my sense is, at least in Latin America, it's kind of a no-brainer. I mean, do we want to stop at 36 months? No. Doesn't make any sense. What I just showed was we can make up that gap, even if they come in as they come in. So it's pretty obvious, at least in Latin America, it may be different in other areas, it's pretty obvious that at least a substantial portion of the gaps that children enter with can be made up with if children are exposed to higher quality early education. And we do know from a lot of other studies, including work that we've done at Caridad Araujo and Florencia Lopez and others in the IDB have done, that the quality of teaching, not just from this study that we've done here, is often abysmal. So yeah, I mean, obviously we can do things. We can do lots of things after 36 months of age. One thing that we can do, given that all the children are in school, boy, it'd be nice if they actually were in a school where they were exposed to teachers that actually taught them something.
Thanks. 10 years ago, I had an opportunity to step out of academia and become chief economist for human development at the World Bank when Norbert was there and Don was there. And when I arrived at the World Bank, the focus on human development was on getting kids in school, achieving primary enrollment. We didn't worry about the quality. We didn't worry about school readiness. There was also focusing on short and skinny kids in India and Africa. Those are the big emphases. Early childhood development 10 years ago at the World Bank was not on the agenda. Here we're 10 years later, and now we're discussing, is this the only period we should invest in? Should we invest in other things? So we've come full circle. I don't think there's any question that we will continue to make these other investments focused on children growing up at disadvantaged settings all the way through their life course. But the money was devoted to getting kids into school, then the new thing were conditional cash transfer programs and things like that. Now, what I think this effort recognizes, and the effort, the 2007 Lancet series, was a rebalancing, recognizing that the highest rate of return, not the only rate of return, the highest rate of return is really in this period and the prenatal care period. And so we want to recognize that. And so if we're giving a policy message, this is an area which has been underinvested in. And I don't think, with the types of comments we heard here, that we should move away from that message. So to you as commissioners. That said, just because a kid doesn't emerge at 36 months within one standard deviation on all measures of development, that we should abandon them, right? We're still going to have them in school, and we want to get the best schools we can get. But as Norbert says, schools exist. We have school policies, and we're talking about making them better. That's a focus of what lots of policy is about. We have when I think about remediation policies, I think about job training and, GED high school. Those are really low rate of return investments. Those are remediation policies. If we're doing our best to help kids at that point, but we don't want to wait that long. So we have this idea that if we can make a massive investment up front, maybe we can reduce the size of the problem by 1/3 to the half. Then they get to kindergarten. Maybe another investment can cut that in half again so that they're ready for primary school. But once they've left primary school and they're not completing high schools, then the types of investments we have to make for both inequality, reduction in poverty and the economy are just massive, and those have real low rates of returns. So I view this period as the highest rate of return and the ones that are underinvested in right now, and we shouldn't lose that focus in the name of, we shouldn't throw the baby out with the bathwater in what we're trying to do now. Albert, I think you're quite right. This is not a low-income country problem. Quality of maternal-child interaction in developed countries is really critical. In fact, when I was a token participant in the 2007 Lancet series, I learned a tremendous amount about early childhood development. The one that struck me is that at that point, 10 years ago, what we knew about parenting, what we knew about early childhood development was all based on the United States and Europe. There was a study here from Peru, there was a study there from Jamaica, but the focus of that study was to get the investment and research in this area. In terms of what I work on, I'm trying to choose a niche, which is where I contribute, which is the long-term economic returns to these things. Really, there have only been a few studies, 3 or 4 studies before this Jamaica study and before the INCAP study that Jerry Berman helped lead, which were all in the United States. And there, the Perry Preschool and the ABC were showing pretty large economic returns, but substantially smaller than what we're finding in developing countries. Why is that true? Well, one, the deficits in developing countries are bigger. And so the types of interventions we make have bigger impacts on cognitive and social-emotional skills. Second, the labor markets in those countries may value those skills higher because they're more rare. And if we can get them into high-quality schooling and prepared, we can have, I think, a bigger impact on economic growth than we might have in the US. Now, that doesn't say that the quality of life and human interaction and preventing inequality aren't important in developed countries. They certainly are. But at least the evidence that's emerging right now is these things are likely to have much bigger impacts in low-income countries than developed countries. And then finally, I always have to laugh every time I come to a audience of health researchers, being an economist, and whenever economists have picked on a message that health services researchers or health researchers want them to hear, then we get berated for taking it too far. So height is something that is a measure, and this came again from my experience in the Lancet experience. So when Sally produced that picture, 200 million, I said, well, where did that come from? She said, well, it's mostly based off stunting, because that's the only measure we have consistently across all developing countries, and we know it's highly correlated with cognitive development. So we're going to just relabel stunting cognitive development. So we use it because it's the data out there, and we use it because you tell us it's important. And so now I want to hear you guys talk about wages and returns and earnings, and we'll see how that works. Okay.
And we need to stop for a break now.
Yeah.
Very good.
So I want to thank this panel, and this has been very stimulating, and hope you'll continue your conversations during the break. We will resume with panel 6 at 11:30 sharp.
Yeah. Hey, so are you